Hello again, Dr. Bruce McNab, PhD, One Health Epidemiologist, with another video working with Novometrics Research Inc., trying to get communications out about COVID-19. This is being videoed on January 16th, 2021. The main reason I'm producing this one is to remind you about our mantra of prevent, detect, protect. Yes, it's good that we now have a vaccine and more vaccines coming along, but it will take time to get them out to people. And in general, we've done kind of a lousy job in that, in getting them out. But regardless, we need to get them out and get the immunity up in the population. And while the vaccines look to provide reasonable protection through clinical trials, we don't really know yet out in the real world how well they'll do at both preventing severity of clinical signs and illness versus, in addition to that, preventing or reducing shedding or eliminating shedding of the virus so it doesn't spread. We have yet to see how well they will work in those different aspects, but it's good that they're available and that they're coming and that they're getting out there. But we are by no means through the woods on this, okay? As we've said in all our previous videos, this spreads like all infectious contagious diseases, it spreads exponentially. And now, mid-January 2021, in the United States of America, we're up to 4,000 deaths a day from this, okay? From the millions of active cases they have. From the millions of active cases that are making new cases and making more new cases per existing case than the existing cases, okay? Or the relative ratio, reproductive ratio, or R, is greater than 1, okay? And then on top of that, exponential spread and growth with doubling from, wasn't that long ago, we had 200,000 deaths in the United States, and now we're almost up to 400,000 deaths, and that can be expected to double again to 800,000 deaths if we don't get our act together, and perhaps even double again to 1.6 million deaths if we don't get our act together, okay? In addition, we have the new strain coming along now that was first identified in the UK, but has now been found essentially all over the place, including North America. That seems to have even be more contagious. So it has a higher R. So it will spread more rapidly and with a higher exponential spread, okay? So that's another reason why we still need to be really, really careful. And that comes down to individual behavior, okay? Yes, the probability of you as a specific individual, being exposed to and acquiring infection with this one interaction today with this one person today is low, still low. But the problem is you have multiple interactions with multiple people every day on an ongoing basis. And the more interactions or contacts you have, the greater the probability of spread. And the more people having a high number of contacts per day, the greater the probability of exponential spread through the population. Now that varies between people. Essential workers have to be out there, so they have to be extra careful, like grocery stores or whatever, grocery clerks or bus operators or whatever. They interact with a lot of people per day. They have to be really careful with personal protective equipment and not acquiring it and not spreading it. But for the people who can stay home, who their job, they can work from home, maybe not as productively as if they were in the office or work, but they can work from home, or retired people or whatever who don't have to be out, please reduce the number of contacts you have by not going out. It's kind of analogous in terms of probabilities to driving. The probability of you having an accident today, this afternoon, as an individual is very low. But the more you drive, the more you're out. The more you drive in less optimal conditions, like bad weather or whatever, the greater the probability you will eventually have some sort of accident. It may not be fatal, but some sort of accident. Well, it's kind of analogous to probability of getting and spreading COVID. The big difference is At least car accidents don't spread exponentially, whereas infectious contagious diseases like COVID do, okay? That's why we have to continue to be very, very careful. We are in for some very dark times because we have so many people now actively shedding the virus, and we have a new strain coming that is even easier to transmit. It's good that we have the vaccine. We need to get people vaccinated quickly. We need to have more vaccines come online, but we are not through the woods yet, and we will yet see a lot more deaths and illness and long-term implications, health implications from this. So please reduce the number of contacts you make as an individual. Only you can control that, okay? Do the best you can, and when you do have to be out, wear masks, distance as best you can, so that we reduce the spread exponentially. You can be an exponential superhero by doing that in terms of the number of cases you prevent, and we need to continue to do that. Please. Thank you.